My name is Nathaniel Matthews-Trigg, the Associate Director for Climate and Disaster Resilience at Americares. Americares is an international relief and development organization, and our mission is to save lives and improve health of people affected by disasters and poverty across the globe. So my work for the last 45 years has been focusing on supporting communities, many impacted by disasters. And Americares has noticed how these disasters are becoming worse, more frequent, and intense due to climate change. And one type of disaster in particular, which is really catching everyone off guard, is heat, the threat of extreme heat and how it's impacting communities pretty much everywhere. And a lot of communities that haven't historically experienced extreme heat all of a sudden are waking up to this threat and how it's impacting patients for the clinics that we support. So Americares, kind of our niche is we support frontline clinics and health centers across the globe. We've got partnerships with over 4,000 clinics, 1,000 of which are in the United States. And kind of my work as a climate technical expert for the organization has been thinking through how do we support clinics, kind of the front line of defense, these anchor institutions and communities to prepare for climate change. What resources do their providers need, their patients, and the clinic administrators? I think we're noticing how there is an incredible gap to fill. So my talk yesterday focused on the need for kind of an all-of-society approach to extreme heat. But too often we see currently that really the focus is on the individual. Kind of what should individuals do? What responsibilities do they have? But what we know is that for every recommendation, people face incredible barriers, financial, physical, social, psychological barriers to staying safe and cool. And when we focus just on what individuals can do, our most vulnerable slip through the gaps. And that's why we see that the number one kind of risk factors for dying during extreme heat is age, kind of having pre-existing health conditions, and social isolation. So these are people that are very hard to reach through kind of personal preparedness activities. And really, we need to focus on the community and institutions that support these individuals to really help build systems of support. As a kind of individual society, it's not surprising that individual solutions seem almost instinctual. I think people struggle to think of how their local institutions, the community, and just broadly public policy is really critical to supporting these initiatives. People think of kind of their power coming from what they purchase or what they do individually, but we're part of a community, and really, especially those who are most vulnerable, really need those kind of levels of support. COVID is a perfect example of this, right? Heat and COVID are actually quite similar. They don't create huge kind of catastrophic disaster, debris, right? Destruction to public transportation or other often critical infrastructure. But what we see is huge numbers of people showing up at the emergency department because they didn't know what to do to stay safe. There were not community institutions that were cooling shelters located in the right part of town. And people really didn't know what they should do when they faced a crisis that they were not familiar with. So one of the things that Americares, in collaboration with Harvard Sea Change, is doing is trying to prepare these kind of frontline institutions, these clinic and health centers that are most vulnerable, depend on to really support kind of community preparedness and also to be involved in the kind of a community response to extreme heat. One of the kind of exciting projects that Americares is doing in collaboration with Harvard Sea Change and really co-developing with clinics and health centers is creating heat action plans. So this is looking beyond just the clinic walls. This is looking at how clinics are a critical piece in a community. We know that clinics are a trusted source of information. They understand the barriers that the most vulnerable face, and they can provide information that kind of vulnerable individuals need, not just in a patient visit, but also during a heat wave. So a part of this project, which we're really excited about, is trying to learn what's going on across the country in the United States currently, and what can we amplify, what case studies can we share so other clinics can learn from other locations, maybe locations that are more familiar with extreme heat, such as the Southeast United States. And what we've learned is that there's a lot of really exciting stuff going on. It's just not being shared. So we have figured out that a really critical piece is creating this process of sharing institution to institution learning, community to community learning. And then through that sharing, we're now starting to hear more clinics are doing the things that they're learning through this project. And does this create exciting opportunities to study real kind of resilience methods, which previously people just don't know were going on, right? The only way we found out about this was from having relationships with clinics, but also we were looking at kind of local media reports where we found, little reports about how some clinic or some public health department was doing something novel out of necessity. Is this something that we could capture and share? And what we're learning is yes, and it's very critical. All the clinics that are part of this project are saying how valuable it is to be able to have a space to learn from each other and to do new things in the face of a crisis, which they're often unprepared for or unfamiliar with. I think people are starting to recognize that really the impacts of climate change are overwhelming, and that unless we really focus on preparedness and mitigation, it's going to be difficult to kind of keep up with the impacts of climate-related hazards. So for example, some clinics we talked to, there was a heat wave and they were overwhelmed by patients coming in with heat exhaustion symptoms. And they did not have the knowledge or the supplies to help those patients where they were. So they just had to divert them straight to the emergency department. And they knew that, clinics all over, people were already showing up at emergency departments. And, COVID again showed us what happens when emergency departments are overwhelmed. Everyone is impacted because whether you're, experiencing heat exhaustion symptoms because you were, jogging too much without staying cool, or you were out in your garden and weren't, staying cool enough. If you get in a car accident and you show up in an emergency department that's overwhelmed, care is often delayed. So really, this impacts all of society. I know I'm talking mostly about those who are most vulnerable, but when we ignore kind of the ways that the most vulnerable fall through the cracks, we're ultimately creating a crisis across our community and across society at large, where everyone is impacted by ignoring those who are most vulnerable. And I think also people are recognizing that there's limited funding out there to do this work. And there's really kind of a cost argument for this. For every $1 spent on preparedness, you save somewhere between $7 to $13 in response costs. So as crises are becoming more common due to climate change, people are realizing we need to invest before the hazard impacts the community and really focus on how do we build resilience kind of in before so we can save money ultimately in the long run. And then also businesses and a lot of the donors to Americares are also kind of expressing how their workers are being impacted by these hazards. That it's really also something that's impacting the economy. Supply chains are being disrupted. Workers are not being able to show up to work because of the impacts of climate change. So if we can build resilient communities, we can mitigate a lot of those impacts.